Welcome back to Expresso on SABC3. Now, breast cancer is the #1 cancer among South African women, and 1 in 26 South African women is likely to get it. Next up, we're going to look at some of the treatments, the therapies around breast cancer, and we've got Dr. Hannah Simonds in studio with us.
By supporting the Flower Valley Conservation Trust, that's where we found goodness. Pick n Pay, always there for you.
So the month of October is Breast Cancer Month, and we've been exploring breast cancer on Expresso, looking at how to check ourselves, what to look out for, and how to have a checkup. Today we're focusing on treatments for breast cancer and what to do if you find out that you have it. And with us is Dr. Hannah Simonds, a special clinical oncologist from Groote Schuur Hospital, to answer some of our questions. Welcome to Expresso. Nice to have you with us. Now, very, very scary for people to be diagnosed with breast cancer. What treatments are available out there, and is it a death sentence?
Not at all. I mean, the most important thing with breast cancer is to make sure that you go to the doctor early. And the treatments really revolve around a combination of things. The most important, of course, is surgery, is to remove the lump. If it's a very early stage, just a small lumpectomy can be done. If it's grown to a larger stage, sometimes a mastectomy is needed. And then usually following that, we look at a combination of treatments of chemotherapy, which people are often very nervous about, but modern chemotherapy is really excellent. It works extremely well. And often we use radiation treatment. Again, people are very nervous when they hear the word, but modern radiation techniques really have very little side effects. And finally, we use hormonal treatment because breast cancer is related to the fact that we're women, and it develops because we have estrogen, and then anti-hormone treatment taken as a simple tablet beyond 5 to 10 years keeps the breast cancer under control. So we have many effective treatments, both to cure and control breast cancer.
Now, South African, we're very advanced when it comes to the therapies and to treatments of breast cancer. What's been the new discoveries over the last couple of years?
Well, there's two main directions that breast cancer development has gone. One is a treatment that we call targeted agents or molecular agents, where we actually look at focusing on the breast cancer cell, attaching to it and disrupting the way it grows. And those treatments are much less toxic than chemotherapy and work very well. Unfortunately, that kind of development is quite expensive. But the drug that a lot of people would have heard of is something called Herceptin, which is available here in South Africa. And secondly, radiation techniques have really improved. Technology is vastly developing, and now we can focus on a small area in the breast, so reducing the dose to risky areas like the heart and the lungs, which people are very nervous about when they hear about radiations. What does the damage do? But radiation and X-ray treatment really is well developed now.
But why are some people more prone to breast cancer than others?
I think it's very common, and we all have a family member or a friend that we know has breast cancer. You've said earlier 1 in 26 women in South Africa will develop it. But there are genetic syndromes. About 5 to 10% of all breast cancer occurs in a family genetic group. And that's because a faulty gene actually triggers the growth of the breast cancer. And those women are unfortunately at risk of other cancers like ovary cancer. And the men in that family are also at risk, not only from breast cancer, but also cancers like prostate cancer. But as I said, it's a very rare incidence that proper family cancer syndromes exist.
Now, if you could give us ladies one bit of advice out there when it comes to regular breast checks, what would it be? Exactly
that, regular breast checks, at least once a month. There's a lot of literature available to have a look at exactly how to do it properly. And if you have access to a medical aid, they all provide screening, free mammograms, free pap smears, which is very important to do. And ladies that don't have access to the medical aid, the state services are available with breast clinics, with a combination of surgeons and other doctors to try and help these patients.
And you can do a self-check at home once a month.
Very important to do so. Yeah.
Dr. Hannah Simonds, thank you so much for joining us on Expresso. We've answered some of your questions, but we'll post some more on our Facebook page, especially on how to check regularly once a month, so you can do it at home. And we'll post more literature on breast cancer and Breast Cancer Awareness Month. Now we're heading on to Graham, who's standing with our Eco Diva. And last week I challenged her to make a pesticide, a natural pesticide, and she did that on the show. This week I've challenged her to make a natural anti-flea spray for dogs and for your pets. Let's see if she's up to the challenge.